Hi guys, this is Arish. I'm a second year medical student at Uni Melb. I'm currently on my critical care rotation, namely the ICU rotation at the moment, and I'm going to be taking you guys along with me today to sort of spend a day in my life as a Melbourne med student. And I'll be happy to answer any questions that you guys have. I'll also give you a few tips about interviewing for Melbourne Med. So yeah, stay tuned. So I'll quickly answer this question just before I head home. The toughest part for me starting med school was technically being away from my family. Yeah, that's really hard. But also the sheer amount of content. Melbourne Med does like 1 preclinical year and 3 clinical years. So we sort of stuff a lot of the major important things in the first year, which means a lot more content than North American med schools as well as other med schools. So yeah, it was a lot of content, but it was definitely doable. So coming to the second part of this question, how long it could be. Honestly, we're not Canadian medical graduates, so it might be 1 or 2 years longer. But I think it's worth the experience coming down under and studying medicine. But I know a few people who've actually matched back into Canada, especially in family medicine and internal medicine. So it's definitely doable. So our current placements are within the city, so we're not sort of leaving the city. It's in the metropolitan area. Especially international students, they're actually given preference to be in the metropolitan areas, and they're the first priority. So all the international students in Uni Melb are in metropolitan clinical schools, so we don't have to go away from the city. So technically, they don't cover our travel, board, and food because we're not leaving the city. Okay, so this question my friend's gonna answer. So Brendan, where am I from?
So Arish grew up in Pakistan. He moved to Canada for undergrad, and he also did some research and work. And now he's moved here to sunny Melbourne.
Yay!
Children.
Good. So I'll try to get through all the questions that you guys have sent me through. So what would the Australian postgrad training pathway look like for surgical specialties? It's a bit longer than what North American surgical pathway is. So what happens here is that after med school, we do 2 years of internship, which is you doing basic intern jobs in Gen Med, Gen Surg, and like you still have those rotations. You do that for 2 years, and then you apply to get into a surgical training pathway, which is sort of the bottleneck. You give GSSC exam, and then you decide to go into each one of the specialties. For example, cardiothoracic surgery or orthopedic surgery or plastic surgery. And so it's a bit longer pathway than North American. So you don't get into surgical specialties right after med school. Instead, you do 2 years of internship. The most rewarding part of med school has definitely been me getting to interact with patients and see how much they appreciate me talking to them, even when I'm like talking to them at wards right now, doing my long cases or like other sort of OSCEs and stuff. And I think the surprising thing is also that you get to that point that, you know, you get to do stuff on your own, like doing bloods, doing cannulas, doing indwelling catheters, and doing a lot of procedural stuff. That's so surprising that even at like a med school or a med student level, you're allowed to do a lot more and like, you know, type notes. So it's really surprising as well as a lot rewarding. So the advice that I would like to give people who are starting med school next year is that enjoy the time that you have between your med school and right now. And because that's the initial time, like before med school, that you don't have pressure of like studying and like going through different stuff and like doing stuff in med school, but also enjoy your med school. It's a journey that you go through, and do not stress. Yeah. So this is a good question. What's been my best placement so far? My best placement has been surgery rotation, because I am surgical inclined, so I know surgery is something that I'm really interested in. I've scrubbed into many surgeries. I've closed patients up like portholes for laparoscopic surgery. The second best, though, like pretty close to surgery, is also ED rotation that I was currently on, and it's such a good experience. Yeah, so I think those both have been like my top two rotations. Hey guys, just got done with my ICU rotation day today, and did a bit of formative assessment. I'm just going to try to answer all the questions that I have right now. So the difference between the private and the regular stream is that you get different sort of caseloads. You don't see a lot of trauma in the regular stream as well, and it's just that in the private is sort of not paid by government, but like your public or the regular stream is actually paid by government. Also, there's just like a difference in structure in private hospitals versus regular hospitals, like which are public hospitals. But not to worry, since we're doctors after first year of internship, we're sort of workforce in shortage, so we get our PR pretty quickly, and so you could apply to other jobs as well after that. Yeah, to sort of ease off the burden, Melbourne is actually pass and fail, so they give you a lot of second chances. A lot of the exams are actually sort of made so that you pass. They wouldn't actually try to fail you, so it's actually really hard to fail. You need to actively do really, really bad to fail an exam. And the people that I know that have failed is usually because of their circumstances, and it's not usually the international students. So I think you're pretty good when it comes to like exams and having second chances. Melbourne's really lenient, and once you're in med school, it's more about doing it right, and you just need to pass. The cut scores are usually very low for exams. It's usually 50%. I think our last exam was 48% because it was actually a tougher exam, so not everybody did good, so they lowered the cut score as well. Yeah, to secure observerships back in Canada or States, you'd usually like to do a few cold emails. It's similar in Australia as well. Even to get like sort of research here, you do a lot of cold emails. It's the same procedure everywhere. So yeah, a lot of like a bit of hard work's put in there, but I think with the effort, if you put enough amount of effort, you'd be able to secure an observership back in Canada. It's not that big of a deal. Okay guys, hopefully I've answered most of the questions that came down to me. I think there's no more questions, but do follow me on my Instagram channel. You get to see a bit of tidbits from med school or med school vlog, day in the life, and sort of those things, as well as you could personally reach out to me, PM me if you have any questions about the med school, as well as the curriculum, how it's gone, and like how life in Melbourne is in general. If you have any questions, just send me your questions and DM me personally. I'd be happy to answer those. Thank you so much.